2019, which had extensively looked at all the referral hospitals, and we'll be discussing that. Dr. Lesiyampe, how is the situation at the Jaramogi Oginga Odinga Teaching and Referral Hospital?
Yeah, thank you very much, Ayub. What I can say is that on the onset of SHA, that was effective 1st of October, the initial 2-3 days, we had challenges. We had challenges in the sense that, one, some of our patients had difficulties in registering themselves. You know, we also had challenges in the sense that, one, we only got one gadget, you know, to register these patients. And three, we also had patients, you know, who were not registered under NHIF in the past. And now they wanted actually to transit to SHA. You know, and it became a challenge because some of them did not even have IDs, identification cards. So from day one, we had those challenges. However, I think progressively, we actually got interventions from SHA. You know, we also had a few staff who had already been trained. And I want to just echo what Dr. Kamuria said. I think what is very, very critical about transition and change is the mental preparedness. And for us as JOOTRH, what we have done was that we took the advantage of seeing to it that we become the first movers and take advantage of the first movers. You know, take advantage of adapters, fast adapters. And what I mean here is that we had already prepared our staff, in fact, from 1st of July, that we're going to have a change, you know, from NHIF to SHA. And we actually went ahead even to establish a department called SHA Coordination Unit. And even went ahead to actually establish, you know, a committee to manage the transition into SHA. But notwithstanding that, we managed to get some of those challenges on day one. And I think also on day two. We also experienced challenges on network, you know, network downtime. You know, those are some of the challenges. However, what I can say is that progressively, some of these challenges have now been resolved. In fact, I think before I even go into that, we also had challenges in pre-authorization. In fact, the first 2-3 days. Pre-authorization for patients to be admitted, you know, in wards. We also had a few patients, you know, who had already been admitted through NHIF. And on discharge, it was actually a challenge. The system could not actually discharge them. However, what I can say is that we have come out of that. And as we speak now, in fact, we are very excited, you know, in terms of the time taken to pre-authorize, you know, patients for treatment.
Okay.
Yeah, so we are also very excited that, you know, it takes 3 minutes actually to pre-authorize a patient to be admitted. You know, similarly, I think when it comes to issues of dialysis and I think chemotherapy, we had clear instructions and I think even clear support from SHA from day one that these are patients who are facing, you know, life-threatening conditions. And therefore, we were to do everything possible to ensure that we transit them, you know, and ensure that they actually get this medication.
And then in that regard, then, the challenges, yes, of the system that you appreciate, what then happens during that process? How